Hello, good morning. Welcome back again to our channel. This is your acute dialysis nurse, and for today's video is about fistula and AV graft. So AV fistula, arteriovenous fistula, this is an example, and then AV graft, this is an example. So fistula, they usually put it first in your forearm, and then going up. They start on your non-dominant hand, and then dominant hand. But for the graft, they can put it here, your arm, upper arm, your chest, your thigh. They can put it in this area. Anyway, if we are assessing the fistula or graft, we're using the 8-second rule. So first inspection. Upon looking at your fistula, assess it if for the presence of abnormalities, signs of infection, aneurysm, those kind of things, or any scab, or just anything abnormal. Next is get your stethoscope and listen for bruit. So start in your anastomosis site and then slowly going up. So listen for any abnormalities it should not be pulses. It should not be a loud pulse sound or loud machine thud sound. So if you hear like high pitch sound on the outflow, meaning here above here in the venous side. So this is called arterial side. This is venous side. So on the venous side, if it's high pitch, then those are signs of stenosis or narrowing of the access. Or if you don't hear anything at all, well, make sure your stethoscope is working. If you don't hear anything at all, meaning there's blockage, so you have to notify your nephrologist. And then next is through palpation. So you palpate for presence of a thrill. So start on the anastomosis, going up. So if you don't feel anything, again, it's a sign of blockage. But sometimes they are deep or they're very faint, so you have to press it hard just to feel it. And next is you check for engorgement. So this is to make sure that you have a good outflow. So if it's laying dependent like that, it should be nice and bulging. But if you bend it like that, it should collapse. It should nice and soft. So like that, it's engorging. It's engorged like that. It's like it's big. But if you lift it up like that, it lays flat. So that's a good sign of outflow, meaning there's no stenosis happening there. But for the same thing, assessment with the graft, but you'll not be able to assess for outflow because the graft is it's a Teflon. It's already a synthetic tubing that's embedded in your skin, so it's not collapsible. So you will not be able to assess outflow through checking for site collapsing. So that's only for fistula. So another tip, by the way, for assessing your graft, you should be able to put the needles in the correct spot, because one is the arterial or the red needle and one is the venous or the blue needle. Now, in order to determine where's the arterial or the blue needle, you have to occlude in the middle. Occlude the middle of the graft and feel the site where you can feel the pulse. So occlude it and then feel on each side. So the site where you can feel the pulse, that is where the arterial side is. So that's where you will put your red needle or your arterial needle. So make sure to assess it carefully, because sometimes it can be tricky, because sometimes we have a looping graft. So if you said looping, so it says here it will go like that. Sometimes there are grafts that that will loop, so you have to assess it very carefully, because if you put the needle the wrong spot, it can cause some recirculation, and it will also cause some hemolysis. It will sometimes it can damage the access. So again, it's very important to assess, for the graft, assess where where is the arterial in the venous site. So that's it. So 8-second rule: inspect, auscultate, and palpate. So before you before you cannulate the patient, make sure to assess first the site, so that if there's any abnormalities, make sure you report it to your nephrologist. That's it. If you have any question, comment, suggestion, please click it. Please type it in the comment box down below. And thank you so much for watching.